important. Whenever there is a problem, it's always best to seek out the advice of someone who has experienced it firsthand. And no one has navigated the healthcare maze like doctors. Two of the best join us now. Dr. Michael Burgess, who also just happens to be a Republican congressman from Texas, joins us. And Dr. Herbert Pardes is CEO of New York Presbyterian Hospital. Without doubt, one of the finest hospitals in the world. Congressman, let me go to you first, because in all the talk about all of these amendments, the 564 amendments, is anybody saying that, look, something that's going to affect 17% of the U.S. economy, just about all of our lives individually, we, the taxpayers and the voters, should be able to understand it? And I read the Burgess markup last week, and I didn't understand a lot of that.
You would think that would be a given. And you know, your earlier question, is there a crisis? Well, we'll all agree, we'll stipulate that there are serious problems in the system. And yet, when you look at the number of people who have currently insurance and are satisfied with their insurance, those numbers are high. So you don't want to upset what a great number of people are already dependent upon in order to fix the problems that exist. Now, here's the deal. We've got 8 to 10 million people who have what are called pre-existing conditions, or their insurance is taken from them with a so-called rescission. And boy, there's nothing that makes Americans angrier than to think that someone's done the right thing, played by all the rules, written out all the checks, and then their insurance gets lost when they have a tough medical diagnosis. We could fix that without really costing a great deal of money. We could have fixed it before we went home for the August recess if we just simply had the political will to do so. And then focus on the next problem, which is portability and affordability. People are losing their jobs. They're worried about being able to afford insurance if they lose their job. They're worried about being able to continue an insurance policy from one job to the next. These are things, again, we could fix, and really they're entirely within our purview to do so.
Okay, Dr. Pardes, from what Dr. Burgess is saying, it doesn't sound like a crisis.
I think it's a very serious problem.
But a crisis, is that overwrought?
Oh, I think it's pretty critical. I think we got to be concerned about the situation with regard to the trust fund. We got to be concerned about the fact that a lot of people are still without insurance and not getting the kind of care that they should. However, I want to agree with Congressman Burgess on several things he said. First of all, getting rid of the pre-existing condition, which I think is a real problem, and second, making insurance more portable will be very helpful to consumers in general. What we really like is to provide quality health care to all people in the country. And the one thing I'd say is, yes, there's a critical issue going on here, but I think we mustn't forget that there's a lot of good care being given by a lot of people who have good insurance, and we want to keep choice.
Well, and frankly, a lot of people that are under your care and under the care of other hospitals in the United States, 85% of the population, and according to one poll, are satisfied with the health care they receive. That means that 258 million Americans don't want the kind of dramatic changes that some people have proposed.
Well, I think what they don't want is changes for them. And I think people who are getting good health care and have good insurance, that should be sustained. But there is a substantial number of people who are not, and I think that has to be fixed.
Right, but Congressman, the question is, do you change everybody's health care dramatically in order to satisfy the few who are not getting, I mean, I'm all for minority rights, et cetera, but you don't want to sacrifice the majority for the sake of a minority.
But in fact, David, I think we could do that. And the problem is we haven't even tried. We haven't even had that discussion. And I'll credit the president with one thing. He brought the insurance companies to the table pretty early on, and they're willing to give up on things they've never been willing to give up on before.
Like what, for example?
Well, the entire concept of pre-existing conditions. Now, they say in order to do that, they need a mandate. Well, a mandate's a tough sell in a free society. There is a constitutional issue there, I believe. But even more important than that, once you tell people you have to buy something, suddenly the willingness of the seller to make a better product, it's gone because everyone has to buy that product. I think you will get better insurance products if you leave competition as part of the equation and create a system of universal access, not a universal requirement, which is what the current plans are.
Well, I think that the plans, to their credit and to Senator Burgess's credit, who convened the process, offered to do an administrative streamlining. And I think that was projected to save something in the neighborhood of $500+ billion over the next 10 years. The issue is how you ensure that that happens and that the savings accrue so Congress can score it and count it as
Do you
real
really
reductions.
think that if Congress, even if Congress does find $500 billion and our health care system is saved, you don't think they'd go ahead and just spend that money?
Whenever
they
That's what we do.
Congressman, go ahead.
That's what we do. We're not transformational, we're transactionalists, and if we have another $500 billion, we'll spend it on something else, so you'll be sure to vote for us next time. Look, the doctor is right. The administrative streamlining and insurance, and goodness knows, the Texas Medical Association, we begged for this type of administrative streamlining 10 years ago when no one would talk to us. Well, I'll give the president credit for that. They are talking about it now, and really we ought to open this up and see what is truly possible. But come on, mandates in a free society, no one's going to believe that's ever going to pass constitutional muster.
Yeah, but if streamlining leads to some money, which enables us to help the small businesses and people who can't get coverage now get coverage, it'll be a very worthwhile process.
I don't disagree. The problem there is getting the Congressional Budget Office to actually give you credit for the savings. And as you know, that has been extremely difficult. That was one of the battles we fought with getting Medicare Part D passed. Yeah, we're going to be doing things better, faster, cheaper, smarter, but the Congressional Budget Office is never going to score that as a savings.
Well, Congressman, the bigger problem for the president is he can't close the deal with the American public. He has this huge media blitz. Of course, he didn't come on Fox yesterday, but he did that today. He was talking with David Letterman. We already know what he said because he taped it already. It's going to be shown tonight. I think we have clips of his Letterman performance. And they were yucking it up. But again, he goes out there, as popular as this guy is, he still can't close the deal with the public. We had a Fox News Opinion Dynamics poll last week. Which would you prefer, the current health care system or Obama's proposed system? And 46% of those polls said the current system. Only 37% said President Obama's system. So the more he's out there talking, the less capable he is of selling this thing.
And if he'd just go on Fox, the deal would be done.
Yeah, that's true.
Honestly, the president could have done this in February when his popularity was 80 or 90%. He chose the stimulus instead, and then they went to the cap and trade nonsense and the buyout of the automobiles. They spent so much political capital in the first 6 months of this year. Healthcare would have been a done deal if it had been the first thing on the list. Yeah. The fact that it wasn't, I think, tells us something.
Well, Dr. Pardis, let me just ask you, we're short on time. Just one. If you had one thing that you could get from a current health care bill, what would that be?
It would be increased coverage so everybody was covered, and a tort reform so we can get malpractice costs.
Are you disappointed that we haven't had any talk by the president about tort reform?
Well, the president did make some reference to...
Yeah, he said the door is open. Ask the congressman if any Republican has been allowed through that door.
It was not strong enough. We need real tort reform, whether that's professional courts, whether that's screening of cases. One way or another, we should get the cost.
Now, you know what the president and others who are against that say. They say, well, that only adds up to a piddling amount of the trillions that we spend on health care if we were to reform the legal process.
Untrue. I mean, you got various kind of projections on this, but there are projections that run as high as $150 to $200 billion a year. And the thing is to partner a number of things which in aggregate can fix it. You can't have any one thing fix the whole problem.
Congressman, go ahead. Give you the last word.
Well, in Texas, of course, we did massive tort reform in 2003. Sure. I think that's a good news story. The fact of the matter is the practice of defensive medicine does consume a lot of dollars, and it's going to take a while to unlearn that professional behavior. I mean, that's the way I was trained, to practice very defensively, and many doctors my age do so at the present time. But still, the journey of 1,000 miles starts with the first step. Caps on non-economic damages go a long way to fix that problem.
Yeah, and it's not just money. That's the thing. It changes doctors' attitudes. A lot of doctors get out of the profession. I've met some who have, or change their location. They can't all move to Texas. If they do, we here in New York are not going to get good medical care. Dr. Burgess, Dr. Pardis, thank you very much, gentlemen.
Pleasure to see you both.
Thank you.
Well,